Hi, my name is Nadiyeth Lopez, and today I'm gonna talk about secondary surgical cytoreduction for recurrent ovarian cancer. This assignment is medical English. First of all, the topics we are gonna talk about are definition, applications in medicine, issued applied in Ecuador, pros and cons, and conclusion. The definition. Patients with recurrent ovarian cancer who have been receiving chemotherapy with no improvement results can be candidates to surgical cytoreduction. But what is cytoreduction? Cytoreductive surgery is an approach to cancer treatment that aims to reduce the number of cancer cells via resection of primary tumor or metastatic deposits in an effort to minimize a potentially immunosuppressive tumor burden, palliate symptoms, and prevent complications. Here's a video so you can understand better.
I'm Dr. Somshikar SP. I'm a consulting surgical oncologist, chairman and head of department, Manipal Comprehensive Cancer Center.
Now we're going to talk about applications in medicine, but first a video.
The ovaries are the female reproductive organs. They consist of three types of cells: epithelial, germ, and stroma. When the cells in the ovaries grow abnormally, they develop into tumors that can be non-cancerous or cancerous. If cancerous tumors are not detected, cancer cells can spread from the ovaries throughout the pelvic region, continue to spread to the abdominal area and other organs.
Metastasis.
Determining the stage of ovarian cancer is very important in developing a treatment plan. At stage 1, cancer is limited to one or both ovaries. In stage 2, ovarian cancer extends to the pelvis area. In stage 3, ovarian cancer is spread to the abdominal region. In stage 4, ovarian cancer extends into the liver or to locations beyond the abdominal area. Ovarian cancer treatment typically includes surgery,
Cytoreduction.
chemotherapy, radiation therapy, or combination of therapies.
In this study, we are learning cytoreductions. So what are the applications in medicine? Assign patients with recurrent ovarian cancer who had received one previous therapy, had an interval during which no platinum-based chemotherapy was used of 6 months or more, and had investigator-determined resectable disease to undergo secondary surgical cytoreduction and then receive platinum-based chemotherapy or to receive platinum-based chemotherapy alone. The primary endpoint of this procedure is to overall survival. This is a picture where we can see the uterus and the ovaries, and in the surface of the ovaries we had a cancer. We are going to learn here the issue applied in Ecuador and the pros and cons of cytoreduction. But first, a video.
There are two large randomized control trials that demonstrate the role of surgical cytoreduction in recurrent ovary cancer. They were both presented at ASCO within the last 2 years, and neither are currently published. We're awaiting the final data, but unfortunately they have conflicting results. So the large European trial demonstrated that there are patients who have a good performance status, low volume of ascites, and those who had an initial primary cytoreduction that was optimal. Those patients may be good candidates for secondary surgery. In addition, in their trial, they demonstrated a progression-free survival benefit. So those patients as well. However, in the GOG portion or version of the trial, there was no advantage of progression-free or overall survival in the patients who had surgery and chemotherapy versus chemotherapy alone.
That is what we talk about. In Ecuador, cytoreductive surgery is important and a very fundamental part of ovarian cancer treatment, as we can see in the video. Multivariate analysis demonstrated that the optimal result of cytoreductive surgery was an independent prognostic predictor of survival. It is concluded that cytoreductive surgery with optimal results is the most important prognostic factor for survival in patients with stage 4 of ovarian cancer. This means when the ovarian cancer had metastasized. Pros and cons. Which are the pros of cytoreductive? Aims to reduce the number of cancer cells via resection of primary tumor or metastatic deposits. Minimize a potentially immunosuppressive tumor burden, palliate symptoms, and prevent complications, like that. Provides a platform for investigation of biomarkers with the goal of optimizing immunotherapy to reverse the immunosuppressive tumor microenvironment and enhance adaptive immune responses. But what are the cons? Increase the morbidity and mortality due to surgery complication. This means a lot of women die during the procedure. Risk of severe bleeding and hemorrhage. Long time of surgical intervention associated with nosocomial infections. This is one of the causes of death. Not convenient when the patients have metastasis, because cytoreductive is for the ovarian and metastasis is a lot harder. For last, a conclusion, but first a video.
Ovarian cancer is a rare disease. By focus on surgeons finding new ways to treat. While the technology isn't new, it is it's all high stage 40 cancer treatment that's salvating some patients.
In the video, we could see how chemotherapy is used in women with advanced ovarian cancer and what are the results. So the conclusion of this study was that in this trial involving patients with platinum-sensitive recurrent ovarian cancer, that means women with had recurrent ovarian cancer, secondary surgical cytoreduction followed by chemotherapy did not result in longer overall survival than chemotherapy alone. This means chemotherapy is still the best way to treat ovarian cancer. Thank you for watching.